Thank you, Mr. Speaker. I want to thank you for the statement you just made and for the very responsible approach MPs have taken to today's question time by sitting a suitable distance apart to avoid cross-fertilisation of this horrible disease. I also want to join the Prime Minister in paying tribute to Lance Corporal Brodie Gillen, who was killed in Iraq last week. Our thoughts are with her family and her friends. Today, Mr. Speaker, people are mourning the loss of loved ones. Many more will be suffering from the effects of coronavirus, including those already losing work or losing their jobs and worried about whether they can keep a roof over their head. Our greatest thanks must go to the frontline medical and public health staff who are fighting to combat the spread of the disease, and to the public servants, postal workers in particular, who've given such sacrifices today, and cleaners who are providing vital support. We must also thank those working round the clock to make sure our shops and warehouses are stocked with the essential food supplies that everybody needs. We on these benches will do our duty to hold the government to account. Together we need to ensure that the most effective action is taken to protect people, and it's in that spirit that I ask questions of the Prime Minister today. Every member of the public will make sacrifices in the effort to stop the spread of coronavirus, but those on low pay, self-employed workers and small business owners are understandably worried. Sue wrote to me this week. Her family is in isolation and says the current £94.25 per week statutory sick pay is not enough to pay for the food shopping. Can the Prime Minister do what the Chancellor repeatedly refused to do yesterday and pledge to increase statutory sick pay to European levels?
Prime Minister.
Well, I want to thank the right honourable gentleman for the way in which the opposition has been approaching this issue generally, and for the cooperation that has so far taken place between our front benches in this matter, because it is, as he rightly says, this is a national emergency, and we're asking the public to do things, to take actions in a way that is really unprecedented for a government in peacetime, and perhaps even unprecedented in the last century. So, to come to his question, it is only right that when we are asking people to take action to isolate themselves if they have the disease or a member of their household has a disease, if we're asking the public to take steps which jeopardise businesses, cause people to risk losing their jobs, it is absolutely right that whatever their circumstances, we should ensure that workers get the support that they need. So in addition to the package of business support that my right honourable friend, the Chancellor, outlined yesterday, we will be working with the unions, working with colleagues across the House. We will be bringing forward further measures to support workers of all kinds throughout this crisis.
Jeremy Corbyn.
The UK sick pay levels lag far behind those of European counterparts. The Scandinavian countries are giving many of them 100% of wages during this crisis. And I hope that when the Prime Minister brings forward proposals on this, they do reflect the reality of people's lives. You cannot feed a family on 90-odd quid a week. And those people, therefore, are putting everybody at risk because they have to go out to work in order to put food on the table. And to claim statutory sick pay, workers need to prove they earn a minimum of £118 per week. So I hope when the Prime Minister brings forward proposals, he will give confidence to the millions of people who work on low-income jobs, are in insecure work or self-employed, and commit to extending a very much enhanced statutory sick pay to all workers.
Yes.
Well, Mr. Speaker, as I've told the House before, of course we will ensure that nobody is penalised for doing the right thing and protecting not just themselves but also other members of society, and of course making sure that our NHS is able to cope. And clearly statutory sick pay will typically be supplemented by other benefits, but we will ensure, and I just repeat what I said to the right honourable gentleman, we will ensure, since the state is after all making these demands of the public and of business, it is only right that throughout this period we should be doing whatever it takes to support the workers of this country throughout this crisis.
Jeremy Corbyn.
What it takes is a recognition of the social injustices and inequalities that exist in this country. And I hope that when the Prime Minister makes the proposals on statutory sick pay levels, that will be recognised. A quarter of the people that are most crucial to support us in this crisis, social care staff, and almost half of home care workers are on 0 hours contracts, so therefore automatically not entitled to sick pay. By not extending statutory sick pay to all workers, the government is forcing social care staff, and they're the people that could unwittingly be transmitting the disease amongst the most vulnerable in our community, to choose between health and their own hardship. Yesterday, the Chancellor, unfortunately, offered nothing to the 20 million people living in rented homes, including 3 million households with children. They're worried sick that they can't pay their rent if they get ill, lose pay, or feel they need to self-isolate. It is in the interest of public health, of the health of all of us, that people don't feel forced to go to work in order to avoid eviction when they know themselves they may be spreading this terrible disease. So will the Prime Minister now confirm that the government's emergency legislation will protect private renters from eviction?
Well, Mr. Speaker, I can indeed confirm that. He's making a series of very powerful points, and I can indeed confirm that we will be bringing forward legislation to protect private renters from eviction. That is one thing we'll do. But it is also important, as we legislate, that we do not simply pass on the problem. So we'll also be taking steps to protect other actors in the economy.
Yeah.
Prime Minister, Jeremy Corbyn.
Seeing the details of that, because all of us represent private sector tenants in our constituencies, and we know the stress they're going through now. They need something said urgently about this, and so I hope the government will say something as soon as possible. Today would be appropriate. NHS staff and those working in the care sector are, Mr. Speaker, on the front line of caring for patients suffering from coronavirus. However, sadly, those workers have no idea if they're actually transmitting the virus themselves. They may not be obviously suffering from it, but they could still be transmitting it. And if they're ill or not, and when they return to work on the front line, what effect it will have. So can the Prime Minister please explain why the government isn't prioritising the testing of all healthcare staff, both those in the NHS and those doing such a vital job in the care sector?
Well, Mr. Speaker, in point of fact, we are prioritising testing of NHS staff for the obvious reason that we want them to be able to look after everybody else with confidence that they're not transmitting the disease. And this country is actually far ahead of many other comparable countries in testing huge numbers of people. We're increasing our tests from 5,000 to 10,000 a day. And it may be of interest to the House to know that we are getting much closer, Mr. Speaker, to having a generally available test which will determine whether or not you have had the disease, and that will truly be of huge benefit to this country in tackling the outbreak.
Jeremy Corbyn.
The World Health Organization said test, test, test. And we should be testing, I believe, on an industrial scale. When I met the Prime Minister on Monday evening, he assured me that there were 10,000 tests per day going on. That's better than none, obviously, but it is nowhere near even the number of people working in the NHS and the care sector. It is a massive undertaking, and I wish there was a greater sense of urgency from the government in getting this testing available for all staff. NHS staff are obviously on the front line, and many are scared because the guidance that has been changed to say they do not need to wear full protective equipment when caring for patients. A senior doctor has said, and I quote, "The rest of the world is providing staff with full protective gear, and we're restricting it." And this is a doctor saying, "I'm scared." We shouldn't be scaring doctors and nurses. Is there a policy for them to have full protective equipment or not? Because I believe it should be the case.
Thank you, Mr. Speaker. We're just quickly on testing, just to reassure him, we're moving up to 25,000 a day. And on PPE equipment for NHS staff, he's absolutely right to raise this, and this is of huge concern, obviously, to everyone, that our NHS staff should feel that they're able to interact with patients with perfect security and protection. So there is a massive effort going on, comparable to the effort to build enough ventilators to ensure that we have adequate supplies of PPE equipment, not just now, but throughout the outbreak.
Jeremy Corbyn.
Mr. Speaker, generations to come will look back on this moment and they will judge us on the actions that we take now. Our response must be bold and it must be decisive. The market cannot deliver what is needed. Only collective public action led by government can protect our people and our society. And that collective action must not allow the burden to fall most on those who lack the resources to cope, as happened after the financial crash. People across the country understand the need for temporary restrictions on our way of life to protect us all, and we will work with the government. But the Prime Minister must understand that will require balancing action to protect the most insecure and vulnerable in the interests of public health as well as of social justice. The health of us all depends on the health of the most vulnerable. So I ask the Prime Minister, will he step up now and not tomorrow and give support to those vulnerable people who live on the margins of our society, are vulnerable themselves and make us all vulnerable, and give them the support and the assurance that they desperately are searching for today?
Indeed, I can, Mr. Speaker, and that's why we've announced another 500 million to go straight into councils to help them immediately with the needs of the poorest and most vulnerable. That's why we've announced immediate cash injections into business to help them through unquestionably a very, very difficult time. That's why we will be bringing forward further measures to ensure that every worker receives support throughout this difficult period. Because no doubt, Mr. Speaker, we are asking, he's right to draw attention to the unprecedented nature of this crisis. We are asking the public to do quite extraordinary things. And we're asking business to shoulder quite extraordinary burdens. But the more effectively we can work together to comply with the very best scientific advice, which is what has actuated this government throughout the crisis, which is what has guided this government throughout the crisis, the better our chances of relieving the burden on the NHS, the more lives we will save, the more suffering we will avoid, and the quicker we will get through it. And be in no doubt that this is, and the Right Honourable Gentleman is absolutely right, this is an enormous challenge for this country. But I think the people of this country understand what they need to do to beat it. And they also, I think, understand that we will beat it and that we will beat it together.